Thanks, Bill.
No
Yeah.
problem. And I've been trying to talk to Adrian on Unity and nobody's answering. You know, word line or something, or? I'll just hang up. Oh, okay. Oh, what did you do? I wasn't sure. There we go. Yeah.
Anything else, Scotty? Yeah, they're gonna start here in about another minute, so just, okay. Yeah, okay. Yeah, I'm not sure if I'm gonna DJ that or not, I don't know, probably not. I don't think there's a request for a DJ, but. Yeah, yeah, I think that's what we'll do. Yeah. Okay, all right. Okay. Cool. I can double check with Steve if there's anything. Okay, all right. Thanks, Al. Okay. Bye.
Seconds.
Good afternoon, or should I say good morning, everyone. I'm Adrian Dix. I'm BC's Minister of Health. To my left is Dr. Bonnie Henry, BC's Provincial Health Officer. And to my right, Dr. Penny Ballum, Executive Lead of Immunize BC Vaccine Operations. I want to thank both of them for joining us today. I want to begin the event by recognizing and acknowledging the history, customs, and culture of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We are grateful to be doing this presentation today on their lands. It's an honor to live and work here. As we enter the holiday season, we also know right now that we are in the height of the influenza season. And as people gather and spend more time together, the influenza virus has more opportunities to spread. This means that we are expecting and preparing for more influenza cases. And so part of our intention today and discussion today is ensure that the prevention that's involved in vaccination is again understood by everybody. That this is the time, particularly for children, to be vaccinated against influenza, to get your flu shot. And here to give us an update on influenza is Dr. Bonnie Henry.
Thank you, and good morning. And as Minister Dix has said, we're here today to give an update on what we are seeing in our respiratory season and to make sure all parents and guardians are aware and know that they can still get children protected, particularly against influenza. As we know from our last briefings, we have seen a number of mostly viruses causing a lot of people to be ill this year. We've had a lot of common cold viruses like adeno and enteroviruses, and one in particular, D68, which did cause some severe illness in children, and that we're seeing is settling down. We also saw a rise in respiratory syncytial virus, or RSV, and our data shows that is also leveling off. And COVID COVID-19 remains steady and particularly affecting older adults, reminding us of the importance still of booster doses with the bivalent vaccine that we know gives greater protection against COVID-19. In our last briefing, we had started to see the dramatic increase in influenza, particularly influenza A, that is increasing, and it continues to increase. In September and in November, we reiterated the importance of protecting children, in particular 6 months and older, from influenza. And we've not seen much influenza in the past 2 years, primarily because of the restrictions in travel. We know that influenza spreads around the globe, and it moves with people as we move around the globe. And we had been watching what was happening in the Southern Hemisphere, particularly Australia and New Zealand. And as we talked about in September and November, they saw an early increase in influenza, and particularly influenza A, in their winter season. And we were concerned that we would see the same thing here. And that indeed has come to pass. We've seen a dramatic increase in influenza A, and it's earlier than we would normally see it, this early peak in influenza. Influenza has started early, and it's mainly influenza A, H3N2 that's causing illness that we're seeing around the province now. And we know from previous experience with influenza that H3N2 does tend to cause more severe illness across the board, but particularly in young children and in older people. And there are more children now who have not been exposed to influenza for the last 2 to 3 years because of the lack of circulation of influenza that we've seen. So more of them are getting sick now, and we see that reflected in absenteeism in our schools, where people are keeping children home when they're sick. And this past week, we've heard from pediatrician colleagues in particular, from BC Children's Hospital and from hospitals around the province, that they're starting to see and hear more about severe cases of influenza, and in some cases, complications from influenza. We know much more than COVID. Influenza can cause more severe illness in children, especially young children, and it can lead to secondary bacterial infections with things like streptococcus or pneumococcus that can cause very severe pneumonias. And so that's the concern that we have right now. Normal influenza seasons before COVID, we would see this type of move through our population. Usually about 6 to 8 weeks we'd have peaks, and they would change over time. And in Canada, we would have about 2,500 to 3,000 people who were affected and died from influenza, and about somewhere between 15 to 20,000 people who were hospitalized across the country. So that's the before times. So what we're seeing now is more typical from a usual influenza season before COVID, but it's happening earlier. And as I said, it does take about 6 to 8 weeks for it to move through the population. We still have time to blunt the impact of this transmission by getting people vaccinated. I cannot stress enough the importance of influenza immunization right now, this year in particular, as the best protection we have against infection and severe illness from influenza, and particularly for children who we are seeing being affected right now. Influenza vaccines are available for free for everyone over 6 months of age in British Columbia, and we have enhanced vaccines for seniors over age 65. Just to remind people, those most at risk of severe illness or these complications from influenza are children under the age of 5. And I will say that there are nasal spray vaccines for children 2 to 17 years of age if they have concerns about needles. Older children and adults with chronic conditions like lung disease or heart disease. Pregnant people at all stages in pregnancy. The vaccine protects both you and your child and gives protection to the baby for the first few months of life where there's no vaccine yet available. So very important if you're pregnant or you're delivering or you have during the influenza season, that the vaccine makes a difference for both of you. And of course, seniors over the age of 65. Now is also the time to plan for the holidays. And we are going to make it, and we are making it even easier and more convenient for people to get their flu shots and their COVID vaccines too, if you're due for those. And I'll be turning it over to Dr. Ballin to talk a bit more about that in a minute. But I do want to talk a little bit about the upcoming holiday season. Now is the time to plan so that you can have a safe and joyful holiday together with friends and families and loved ones, something we have missed for this past 2 years. But we are not out of the woods completely yet. So we need to be extra sure we continue to protect ourselves, our families, and our communities as we go into this important holiday season. And that means, number one, get your vaccines and ensure children are protected too, both for influenza and for COVID. Staying home or away from others if you're sick, especially if you have a fever. Fever is a pretty good sign that you have something that is infectious to others, and that's an important sign that you need to stay home and rest and recover. And take extra care around infants because we know they are susceptible to more severe illness, and so we need to protect them when we're in respiratory season. Cleaning our hands regularly, practicing respiratory etiquette, which means covering your cough, using your sleeve or tissue and then disposing of it. Wearing a mask. If you have very mild symptoms and you're not sure if you're incubating something, or if children are sick, for example, in your house and you go to work, those are times when wearing a mask as a prevention measure is important. And we should think about postponing visits to people who may be more at risk if you're not feeling 100%. We also encourage people to wear a mask if you want that extra protection, especially if you're in a crowded indoor setting with people you don't know. I think it's also really important for us to remember what we've been through in the last 2 years and make it okay in your holiday plans for people not to come or to be able to participate remotely or outside if they or someone in the family is not feeling well, even if they're ones that are supposed to bring the turkey. Make it okay. We've found many, many ways to be able to safely be together, whether it's virtually or outdoors if we need to, and we need to remember those ways as we go into this holiday season. We need to remember to be patient and flexible this year as we transition to more normal celebrations like we used to have, because we still have COVID-19 and also influenza here now. I also want to talk a minute to faith leaders. And I am so appreciative of the way that faith leaders have supported communities across this province through these last few years. And I want to encourage you again to find ways to celebrate these most important days that are coming up, that people can participate safely, having the ability to broadcast, for example, or to participate remotely for those who feel sick, or for people who feel at risk and aren't comfortable yet in being in those settings with others. The many ways faith leaders have been supporting their congregations through these difficult years, those are things that we need to do again to get us through this year and to be able to celebrate together. As I said, typical influenza season lasts about 8 weeks, so it is not too late to make a difference now. We can blunt this curve, prevent the spread to family, to loved ones by vaccination now, before the holidays, so that we can have safe and joyful gatherings and activities together. And as I said, we're going to be making it much easier for parents to add this into their day during this busy time. And I'll now turn it over to Dr. Ballum to give you some details.
Good morning, and thanks so much, Minister Dix and Dr. Henry. It's always a privilege to be here to just give our public some basic information about, how they can access an influenza vaccine. And particularly today, I just want to share with you, how we are trying to make it easier for parents who are currently in one of the busiest times of the year to get their kids vaccinated. We've had a very strong and enthusiastic response to the influenza campaign. We've vaccinated over 1.5 million people, which is much above last year, and I believe getting to a record in the province. We've used about 70% of our vaccine, and we have more in the wings coming in to make sure that everybody has a chance who wishes to get vaccinated. And generally, with the high-risk groups that Dr. Henry has identified, we're doing well. Over 50% of seniors over 65 have been vaccinated. We do track people with chronic illness so that we can prioritize them. 40 to 45% of them have come in and got an influenza vaccine. And, you know, really our concern, as Dr. Henry has said, is children, particularly those who are 6 months to 4 years who are in the highest risk group. They're the most vulnerable. And amongst those children, we have only 20% have been vaccinated. For those 5 to 11, 20% have been vaccinated. And for our teens, only 15%. So I think our call out today is to all children and youth, and particularly the small ones, to make that extra effort on behalf of their parents to get them vaccinated. Now, I think the public are very familiar with the Get Vaccinated system. It's a remarkable way that they can be notified of when a vaccine is due, and they can go in and, you know, book themselves or their children a vaccine in one of many options that is convenient for them. To date, though, we only have about 50,000 of the most vulnerable children, 6 months to 4 years, who are actually registered in the Get Vaccinated system. And one of the steps that we're taking today is that we're going to take information that is in the provincial registry and use that to send a notification through Get Vaccinated to parents. We know that some of those notifications won't reach them because the telephone number we have is possibly a landline, but parents in the age group of children of 6 months to 4 years are, you know, very savvy. Most of them operate off mobile phones, and so we're hoping that the majority of these notifications will go out and reach them, and we will encourage them to get their children registered. Then we can send them an invitation link, and they can book an appointment in you know, many of the health authority clinics that are around the province, waiting for them to come in and receive their vaccine. There are lots of options available for parents to bring their children and youth in to get vaccinated. We have about 2,000 family doctors who have received influenza vaccine through the health authorities and who are able to provide vaccination. So, you know, parents can phone their family doctor's office and see if there's vaccine available and bring their children in to get vaccinated. There are health authority clinics if your family doctor does not have vaccine, and these clinics are specifically set up to welcome children, to make them comfortable. You know, a few extra touches, coloring. Some of them are able to put decorations on little Christmas trees. There are balloons, and we generally try and make those children's clinics, you know, a very safe and comfortable place for children, you know, especially the little ones, to feel okay. And for infants and toddlers, for children 5 to 11, they can receive their vaccine at a pharmacy as well. And there are about, you know, 250 pharmacies across the province who are welcoming children in that age group, 5 to 11, and providing vaccine. But actually, any pharmacy, you know, is legally able to provide vaccine to children 5 to 11. So generally, as you can see, we've got a lot of access around the province. We have about 140 health authority clinics that are designed just for children, and there are thousands of appointments available on the Get Vaccinated system. At the end of this week, we'd like to sort of have a blitz, as I called it, a Vaxafluoza, to welcome kids. There's a special effort that's being planned by the health authorities, by our pharmacy colleagues, and we hope by our family physicians to really make an extra effort. If you get Friday, Saturday, and Sunday and get a vaccine, you're ready for 2 weeks away when your immune system has responded and you're moving into your holiday season with your family. So December 9th, 10th, and 11th, a special effort. Lots of walk-in availability for families to bring their kids in. There's a lot of effort being made to make sure that we've got the vaccine available and it's in convenient places and that we're able to welcome families. We encourage families to book an appointment if they can through Get Vaccinated. And as I told you a few minutes ago, we're going to send out notifications to families who do not have their children in that system to encourage them to do that. So Just a little note on what you need to get your child registered and get vaccinated BC. First of all, you go to the website, getvaccinated.gov.bc.ca. You need your child's full name, their PHN number, their date of birth, and the postal code where they live. That's all you need, and you can get your child registered, and within a few hours, you will receive an invite to actually book them into one of the many clinics around the province, and if they're a little bit older, to a pharmacy where they can get a vaccination. So I'm gonna close there just to say we have ample vaccine. Most vaccines in the influenza category can be used for children. As Dr. Henry mentioned, we have some flu mist still available, and that's for children who really have a problem with a needle. You can ask for that at the clinic. But generally, there's vaccine, there's a lot of information on the government website, on the health authority websites, on the BC Pharmacy Association website, and on BC CDC's website for information about influenza vaccine, for where you can get it. We want to make it very, very easy for people to feel like they have access to, what do they do and where do they go. And the Provincial Call Center is always available to answer pretty much any question and book your child in if you can't get to it using the internet or online. So to all our parents of children in the province, we're here to help you and support you in what we know is the busiest time of year for you and your family. Please reach out to your local health authority, the Provincial Call Center, to your local doctor, and help make it happen to protect your children. Thank you so much. Mr. Dix.
Thank you, Dr. Henry. Thank you, Dr. Ballum. And obviously, vaccination are our best tools to combating influenza, to combating COVID-19. And I encourage everybody to consider booking a flu vaccine appointment soon. As Dr. Ballum has said, this is going to be a record year for flu vaccination. And while that record has been going on by our healthcare teams, extraordinary teams of pharmacists, community pharmacists, of health authority clinics, of family doctors, while all that's going on, we also have done more than 1.5 million people to get their COVID-19 booster shot. And we need people to continue to do that, and adults could continue to do that. As Dr. Ballum has said, 55% of people, 11 out of every 20 of seniors over 65, have got their flu vaccine. However, that number can be higher, and importantly, should be higher as we go towards the holiday season. So we continue to encourage everyone in BC to get their flu shot, to get their COVID-19 bivalent vaccine, and there are opportunities available to do that everywhere in BC. The focus today is, of course, on children. 21% between 6 months and 5 years have received their flu shot. About 20% of those 5 to 11 received their flu shot, about 15% 12 to 17. Particularly in the first two categories, though, we strongly encourage all parents to get their children vaccinated against influenza this year. Getting vaccinated, of course, also helps reduce the load on our healthcare workers and our healthcare system, who've been working tirelessly to keep British Columbians healthy in difficult times. And I'd like to take this opportunity to thank every healthcare worker, every healthcare professional for all the work they're doing. Their work is, of course, not easy, especially during the colder months. And the ongoing commitment of healthcare teams to the people of BC is deeply appreciated, I know, by me and by everybody else. Our hospitals are ready and continue to be ready for the surge of patients that comes with respiratory illness season. And we will get through this season together. We've seen an increase in emergency room visits, particularly in the Provincial Health Services Authority, we're talking about BC Children's, and in the Fraser Health Authority. Over the last month, we've gone roughly in terms of emergency room visits. If you take September and October and compare it to November through December 2nd, we've gone from about 6,700 emergency room visits a day to between 6,800 and 6,900. And that is reflects those increases, especially at BC Children's and in the Fraser Health Authority. In addition, we continue to be taking measures to support our healthcare system and especially to support our emergency rooms, where we're seeing significant and ongoing pressure on the healthcare system. But the way we can all do this, we all have control and power as individuals in the community. The way we can help the healthcare system is to get vaccinated against influenza, to get vaccinated against COVID-19. That is something we all have in our hands to do. But more important than that, especially when it involves children, it's an opportunity to protect them against influenza and its impact on them, to protect them against COVID-19 and its impact on them. We can all do what we need to do to be ready as well. We need to get vaccinated. We need to wear a mask if we have mild symptoms. We need to stay home if we're sick. We need to wash our hands frequently. We need to keep doing what we know and keep doing what we know works. And with that, we're happy to take your questions. And I'll invite Dr. Henry back to the podium.
Thank you to all our speakers. As a reminder for media on the phone, please press *1 to enter the queue. That's *1 to ask a question. For media in the room, please line up at the microphone provided, and please make sure to provide your full name and outlet. We're going to start in the room today, so please go ahead.
Good morning, Sinjin with CTV. A lot here to go through, so let me try this. It sounds like after years of COVID that perhaps the flu is now your #1 concern. Is that the case? And also, was there any discussion about the push for kids to limit how many adults get the flu shot and instead just give them straight to kids so that, do you know what I mean by that? Just because there may not be enough. Is there enough for everybody that you may have had the discussion that perhaps we should only give them to children?
Yeah, so the first answer to the first question is, you know, we've been watching and we were concerned that we would see an early influenza season and that it would come at the same time that we're seeing increases in COVID-19 that we've seen seasonally for the last 2 years. And that is indeed what we're seeing. We did see quite a lot of RSV, but not as much as some other parts of the country. But right now, for children, what is making most children sick, what we're seeing the greatest proportion of is influenza and influenza A, and it's an influenza A H3N2. So that's one that does cause more severe illness historically across the board. So the answer about whether we would reserve for a flu vaccine for children only, we believe we have enough, and we certainly have enough for children right now in the province. And we see that influenza causes more severe illness in older people as well. So unfortunately, older people have the double whammy of being very severely affected by COVID and also by influenza, and particularly influenza H3N2. So we do need to make sure that it's available for people at high risk, whether they're children with underlying conditions or adults with underlying condition or older adults. So we do have enough for everybody across the board. That's really important. What we're seeing that's different in children and why we're focusing on that today is we do know that children have mostly milder illness with COVID relative to adults. But that's not the case for influenza. So it is really important this year, more than most other years, that we protect children as best we can.
Okay. So very sad news, of course, I'm sure you heard of Richmond. It looks like a 6-year-old girl, Danielle, passed away from complications due to the flu. I'm sure you've heard of this, and I'm sure just your reaction to that, if you could, Dr. Henry.
Sure. We do know that there have been a number of children around the province who have had influenza, and I can't comment. I don't actually know the details of this person in particular. But yes, we've had a number of children who've had more severe illness. And one of the things that we see with influenza that we don't see with COVID, for example, in children is having secondary bacterial infections that cause pneumonia, sometimes meningitis. So very severe infections that have sometimes very tragic outcomes. So yeah, that is something that we're, it's always heartbreaking to hear about severe illness in young children, and that's why it is so important to do the best that we can to protect them, and that's where vaccine comes in.
For our next questions, we'll be going to the phones. Richard Zussman, Global News, please go ahead.
Dr. Henry, you've encouraged people before to go get vaccinated, and the rates among children are still low. So what is the hope here that will be different this time around in terms of increasing rates? And is there any consideration being given to requirements around vaccination within the school system? And what tools do those in the school system have if kids come in sick? My understanding is there's not a lot of power a teacher has if a student comes in and is sick to ask them to go home.
Yeah, so, I think it's not a surprise, I don't think, to parents around the province that kids are getting sick with respiratory illnesses right now. And we're seeing that in absenteeism in schools where people are keeping children home, which is good. But I want people to be aware that we can still make a difference. We are still early on in this trajectory of influenza. We're starting to see the impact of a large number of children who haven't been exposed to influenza for a few years, and a small proportion of them are getting severely ill. So now's the time to really make a difference, get the vaccine now, especially we know that there's going to be activities during the holidays. We're going to want to spend time with family and friends, and that's a situation where we can spread the virus even more. So really important. Now's the time to get this done. We're making it easier. As Dr. Ballum said, we'll have walk-in days at clinics this coming weekend. And that gives you the time to protect children as best we can as we're going into this really important time.
Richard, did you have a follow-up?
Why not create requirements? I know that vaccine requirements are controversial and they've caused problems in the past, but why not put a requirement in? We did it when adults were getting very sick and the threat of dying, and there seems to be more of reluctance now for various different reasons. Like, are we doing as much now to protect children as we did to protect older adults at the height of COVID?
Yeah, that's a really interesting question. I mean, influenza is something that we've been living with for many, many years, and seasons tend to fluctuate. The vaccine is available. Most children do have mild illness, especially school-age children are mostly have a mild illness from influenza as well. But we know that they can amplify it and spread it in their families and in communities. So it is partly where do we see influenza having the most severe effects? And of course, the most severe effects are in younger children who aren't in school. We do have promotion for children for influenza vaccinations, but we haven't made them a requirement in any situations, with the exception of the long-standing vaccinate or mask policy that we had in healthcare settings. So we focus on mandates, if you will, in those settings where they're going to have the most impact and where it makes the most difference. And that's why we still have mask mandates in all of our healthcare settings, where we still have vaccination mandates for COVID and the requirement for influenza vaccination in healthcare settings, because those are the settings where the most vulnerable people may be exposed. We generally have not had vaccination requirements for children for a whole variety of things that can spread in schools. What we do have is the reporting requirement that came into place in 2018, where we have reporting of vaccination status of children in schools. Influenza is not part of that because it is a vaccine that changes every year, and that we need to update every year with the changing influenza virus. So it is a balancing of where these have the most impact and where they have the most benefit. And mandates are always sort of the last resort. I don't know if you want to speak to that at all.
And just to say, Richard, you recall in 2019 when we dealt with, I think at the time, 29 cases of the measles in BC, but given that we had largely eradicated the measles, that was a significant issue. What we did at that time was what we're doing today, which is is significantly improving access and providing the public with information about what they need to do, especially to protect their children. One of the things that was so important in that time was the number of children, 16, 17, and 18, who chose to get immunized against measles at that time. Right now, the situation is that roughly 21% of those 6 months to 4 years and 364 days who are eligible are vaccinated against influenza at this time. And as you know, the numbers on COVID-19 are also in the same range or lower. And so I think what we're saying to people today is take advantage, especially in this pre-holiday season. You can still have an impact to protect your children as individuals, which is the most important thing, but also to protect the community. And we found this to be effective. You'll recall, I think, in spite of the small number of people who hadn't been vaccinated against measles at that time, about 38,000 took part in that. A lot of them were 16, 17, 18-year-olds who were making that decision for themselves at that time. So I think that's the effective way of dealing on the issue of vaccination. We do have, of course, vaccine requirements in our healthcare system. We do have mask requirements in our healthcare system. But this is an opportunity for everyone, and I think Dr. Henry has said it well, that this is an opportunity right now to positively affect the situation for the whole community, most importantly for your child.
Our next question, we're going to Vaughn Palmer, Vancouver Sun. Please go ahead.
Dr. Henry, thank you for doing this as always. The COVID-19 operations review that was released Friday by the government reported on what it characterizes an erosion of trust in public health measures and expressed a concern that it could translate into more public resistance to advice on public health measures. Do you think that may be a factor in why so many parents have so far not got their children vaccinated for either the flu or COVID?
It's an interesting question. I think part of it is that, we've been talking about this for a long time, and until it becomes very real, there's sometimes a challenge in fitting it into a busy day, and especially parents of young children. They have a lot going on right now, and that's why we need to make it as easy as possible for parents to do what they need to do with children. And I hear that from parents all the time, that, oh yeah, we're going to get the kids vaccinated. We just had this going on and that going on in school, and it's busy. And so what we're doing today is saying it's really important. What we're seeing is children are being affected. We know that in the holidays we want to get together again, and it's important for us to do that. We need to do that this year. So the best thing we can do now is make it easy for you to drop into a clinic anywhere in the province, bring your children, you can get your vaccine too, and we'll get it all done so we can have the safest holidays possible.
Vaughn, did you have a follow-up?
Yes, please. The operations review also recommended, in one of their findings, that the provincial health officer office conduct a review of public health measures during COVID-19 to determine which ones worked best. Is that a review that you would be open to doing, and if so, when would it likely be conducted?
Yeah, I think it is something that we're not only open to doing, but are doing, not just us, but across the country. I'm talking with my colleagues, and globally. It's very, very challenging, though, just to put this on the table, to tease apart, because many of these things came in together. And I talked about that a little bit on our last call. When we had a lot of COVID and many, many people were vulnerable, we needed to put in layers of protections because we didn't have vaccination, for example, and it was causing severe illness across the board. So those layers of protections that we put in, it's very difficult to tease out, was one better than the other, or was it the combination of them? And then as the immunity went up and as cases went down, we no longer needed to have the multiple different barriers. So yes, we absolutely are committed to trying to understand which combinations, as best we can, worked best in which situations. I think one of the things that I took out of that report, and that I've been thinking a lot about myself and with my colleagues over the past 2.5 years, almost 3 years now, is the fact that things changed. Things changed a lot during this last 3 years. It's a long period of time. The virus changed, our immunity changed, and immunity is complex. The things that we were doing changed, what was happening globally changed. And every time there's a change, trying to adjust to it and trying to find the best, least restrictive means of doing things was a challenge that we had. So things like the testing protocols changed for a whole variety of reasons. And part of that was we have to become comfortable with changing tactics as the situation changes. But that's not always easy. And we get into a pattern, we understand certain things, and it becomes challenging when things change and we no longer know what to do. And that anxiety causes a lot of concern for people. So I think we as a community in public health, and myself in particular, need to learn how to talk more about change and communicate why we're doing things and why the changes are, and help people with that anxiety that comes with things changing over time. So it's certainly something that I'm very interested in, and how do we do that in a way that helps build up trust again?
For our next question, we're going to Justine Hunter, Globe and Mail. Please go ahead.
Thank you. I heard the health minister say that hospitals in BC are ready for this surge. We had a story over the weekend that shows hospitalizations of children with the flu have skyrocketed across the country. 223 children admitted in 12 hospitals with the flu, where normally you'd have 11. Can you tell me what the admittance rate is right now in BC, and how would you describe the state of capacity right now for pediatric ER?
A couple of things. I think your story in Globe and Mail showed that many jurisdictions have it worse than us, but that it's a significant situation here in BC. In a general sense, we're seeing an increase in emergency room visits at BC Children's that everyone can see, which is the result of it being respiratory illness season. In terms of pediatric and neonatal ICU, it's been relatively stable in November and December against September and October. Overall, we're seeing approximately 200 people more a day in terms of our daily census in hospitals across BC. I think the important thing to remember, though, is that while BC Children's is very important and significant and obviously a site of interest, really it's affecting every hospital in BC. We tend to have a lower level of occupancy at BC Children's than we do at hospitals that take all patients, and that's certainly the case right now. So yes, I think if you look at what we've seen, for example, in interior health, in terms of emergency room visits against a typical November, they're significantly higher. I think they went from about for respiratory illness from about 300 to about 1,000 in interior health, and that's what we're seeing, and that's what we're responding to. So that means we're taking a series of actions in emergency rooms, particularly at BC Children's, as you know, the opening up of triage in BC Children's, and I'll just, if you'd like, Justine, just list off what we've done since those announcements we made at our November 16th briefing. We obviously, at Victoria General Hospital, we now have pediatricians providing care in the ER. BC Children's has activated their emergency department satellite clinic, and we would expect that clinic to still be in place right through, tentatively through to March 31st, 2023, or until the surge abates. Effective next week, Surrey Memorial will have a process to redirect some patients from the ED to emergency room physicians at the Surrey Urgent and Primary Care Centre. Children and youth in White Rock, South Surrey, have opened. We've opened a pediatric access to rapid care clinic at Peace Arch Hospital, which has a positive impact there. And there's a series of actions that, of course, were put in place before, including the opening up of long-term care beds, 187 of them, in order to move people who should be in long-term care from acute care to long-term care, and those beds are continuing to open. So those are the steps we're taking to prepare our healthcare system. And but I think the key message from us today is that there's another way we can all do that, and that's increase our rate of vaccination against influenza. And just note in terms of the question I think that Vaughn asked earlier, one of the differences we've seen is 2020 and 2021, we had relatively mild influenza season. And that is a significant effect on people getting flu shots. So there may well be children who as a result of that, haven't got flu shots in previous years. Well, they need to get them. This year, influenza has come back as it was in a number of years prior to COVID-19. And so that's a real change. And so we continue to give that message. We're going to have a record number of people getting flu shots this year. But a record number is not what we're looking for. We're looking for as many people as possible. And if it's your child, your loved one, your grandmother, your grandparent, whoever it is that's vulnerable, we need everyone, or as many people as possible, to get immunized, both against COVID-19, of course, but especially right now against influenza.
Justine, did you have a follow-up?
Yeah, thank you. You did list off a whole bunch of things that BC has done. Is there, can you explain why we haven't got the message out? We knew that there was a flu season that was coming early. There was a new system put in place through the Get Vaccinated program. I guess I'm wondering what's going to change this weekend to get parents to get their kids in, and why weren't we doing that accessibility piece perhaps earlier?
Well, we have. We're just making the point of it now again. I talked about this in September. We talked about it in November. Pediatricians across the province have been reaching out to children in their practice to get the message out. This is just reiterating that, yes, we do need to, and to try and talk again about the fact that there are walk-in clinics, drop-in, walk-in weekend, next weekend, and making sure that we're adjusting the clinic schedules so that parents are aware that they can do this, and making special efforts over the next little while. And it partly is, where we are in the influenza season, and it's partly because we're heading up to the holiday season. So I want to get that message out to people that we can still do things that will make a difference and make it better for us and our loved ones and our families in the coming holidays.
For our next question, we'll go to Lisa Eusda, City News. Please go ahead.
Hi there. I'm wondering why, if this is so urgent right now, which it clearly is, why not just drop the get vaccinated part entirely and just let people walk in wherever they want to get this vaccine? And I'm also wondering with that, if you can also talk about the efficacy of this vaccine, like how great a protection do you get from it?
Yeah, so influenza vaccines, as you know, change every year depending on the strains that we expect to see circulating. And this year, so far, we've been seeing across this country and the U.S. as well, primarily influenza A, H3N2, as I mentioned. And so far, the lab tests are telling us that it's a very good match to what's in the vaccine. So the vaccines that we have this year, they have two strains of influenza A, so an H3 and an H1 strain, an H1N1 strain, and they have both strains of the B virus as well. So unfortunately, we can't tell the vaccine efficacy until enough people have been vaccinated, and we've seen enough cases in both vaccinated and unvaccinated people. So it's one of those things that we could look at retrospectively, but all the indications so far are that there's a very good match with the vaccine. So we know that when there's a good match, we can get 50 to 70% protection against infection and against illness with influenza. So it's not that we're saying that it just started today. We've been saying this for the last few months. We just want to reiterate to people that it's not too late. The vaccine is still available. Get vaccinated is the easiest way to do it, but we know that there are challenges, particularly parents with young children. There's lots going on. So we have increased the availability for younger children, and we're just reminding people that it's going to be available, especially in the next coming days.
Thanks, Dr. Henry. And maybe I could just add a couple of points. The Get Vaccinated system has been, highly, highly appreciated by the public. They really like that they can book an appointment, and we've had an enormous amount of feedback. After the initial sort of change where people said, oh, I used to walk in and now you want me to make an appointment. And I think, at the very beginning of the campaign, it was a little bit shaky as people got used to the notion that they could actually get a notification and book a vaccine. But generally, it's been really well received, and it just provides the clarity and certainty for people that they know where they can get it. They don't have to phone around to different places. They can go on this one system and see the many options for them on a geographic basis. So it's been really successful, and I think in part accounts for the very high uptake we've had. The difficulty that we have with children, especially the small children, is that they're not in the system, and we haven't been able to notify their parents. And so we've done some work with the government and with the data set in the PIR, in the provincial registry for vaccination, and we're going to work backwards from there and be able, through the Get Vaccinated system, to send notifications out. And that's, as I said, going to start today. And there's about 150,000 children who aren't in that system that once they're in, we can invite them. And their parents then can make an appointment, or we will welcome them if they walk in. Generally, staffing up for the uncertainty, if everyone decides to walk in and some people book it, it does make it less efficient for everyone, for staff and for people who end up queuing to get into a clinic if there are a lot of drop-ins. So this smooths it out, but as Dr. Henry has said, we want to make the next few days, and particularly next weekend, Friday, Saturday, Sunday, a time when we're really putting a massive effort on to allow people to walk in, make an appointment, get into our clinics and call their doctor's offices and, visit pharmacies if they're old enough to get a vaccine in pharmacies and get the job done and get them protected for the Christmas or the holiday season. Thanks.
Lisa, did you have a follow-up?
I'm just wondering a couple of things I'm going to throw in here. Like, do we know how many kids are absent from school, how great that is? And why not do, 20% seems incredibly low for 5 to 11-year-olds, 15% for teenagers. Why not just do a couple of vaccinations within schools? I know there's, a lot of workforce for it, but if it's that urgent, why not use that? We just had the HPV one at our kids' school, and it was incredibly efficient.
Yeah, and in some places around the province, they are doing school-based clinics. For the most part, though, especially for the younger children, we've heard from families that that's not their preferred place to have children immunized. Although we do often use schools after hours because they're familiar places for parents with young children to bring them in to be immunized. So it is trying to find the right place in the right setting, and in some smaller communities, the vaccination clinics are often in schools or associated with schools. But all of the clinics around the province now are also providing COVID and influenza vaccination, so you can get them both at the same time. In terms of absenteeism, that is something that the superintendents and the individual schools report on regularly and have a good sense of. And yes, we have seen increased absenteeism. The biggest concern that we have, of course, is that schools are able to function safely. And for most part, that has been, we've been managing around the province. And I think it's a reflection as well of lots of children getting mostly milder illness, thankfully, but also that people are doing the right thing in keeping children home. And I know it's a stressful thing sometimes when lots of kids are sick, but we are expecting to see this, particularly this year, when we haven't seen RSV for a while, we haven't seen influenza for a few years, that it's going to be, and that we still have COVID here. So this is going to be a transition year, I believe, and then, hopefully by the time we get to next respiratory season, we'll be in a better place.
For our next question, Jane Scribnick, Black Press. Please go ahead.
Hey there, thanks for taking my questions. I just wanted to confirm one thing with you, Minister Dix. You mentioned 300 to 1,000 cases of respiratory illness among kids in interior health. Can you confirm what time period was that over? And do you have similar numbers for the rest of the other health authorities?
Yeah, we can get you that. Those numbers are from Dr. Fenton in Interior Health. They reflect the situation there. So that's an increase in visits to emergency departments from November to November for a respiratory condition. So that's the specific statistic we're talking about, and Dr. Fenton talked about that in some media discussions over the past weekend.
And Jane, did you have a follow-up?
Yeah, I'm also just wondering how far along into the 6 to 8 week influenza season we are right now.
Yeah, so we look at the data that we started to see quite a dramatic increase about 2 weeks ago. So I would say we're in the sort of 2 to 3 week phase of it. It tends to last 2 to 3, 2 months or so. So it's not too late to make a difference, and we've seen it level off a little bit in older teens, but definitely increasing still in the younger children. So not surprising, this is what we saw in Australia and New Zealand as well, that we had a very steep peak. What we hope and why we're talking again today is we can blunt that peak, and we can prevent that ongoing transmission to older adults as we come together over the holiday season, which is often when we see our influenza peaking. Before this pandemic, what we saw was our peak of our season tended to be in January after the holidays, when people were mixing and there was more spread. So we want to prevent that this year, and we have the opportunity to do that by making sure we take some action today that will make a difference.
Our next question is for Rob Monroe, Info News. Please go ahead.
Hi, I just want to clarify if I heard Mr. Dix correctly saying those interior numbers were from November of last year to November of this year, which means we're not really comparing apples and oranges. But why the interior would possibly be worse off than other places?
It's not necessarily worse off. This is a province-wide circumstance. The numbers and the response at BC Children's is typically more weighted to Metro Vancouver, although obviously BC Children's takes patients from throughout the province. All this is a regular reporting that's done through Interior Health that talks about, that Dr. Fenton talked about this weekend with respect to Interior Health. But I think what we're seeing is amongst children is a more significant influenza season by a very significant margin than last year, and that reflects that. The presentation at emergency departments reflects that. But look, I mean, you want to take a step back to where we were in 2021 in Interior Health, August, September, October, November. In Northern Health, August, September, October, November. With the Delta variant of concern of COVID-19 in that period, we flew people in the hundreds who were from ICU, so these were every case serious, down to southern British Columbia hospitals in order to support them with care. That's what occurred in that time, and we had a very challenging time, as you recall, and throughout that period there was deferrals, for example, of non-urgent scheduled surgeries. So we've been going through this for 2.5 years. What makes this qualitatively different is influenza against last year, which is significantly higher and which has been higher in every jurisdiction in the country, and is higher here in BC. So that's what we're seeing. But I don't think it's particularly more significant in Interior Health than everywhere else. It's a challenge everywhere in BC, and that's why everywhere in BC it's important that people get vaccinated.
Rob, did you have a follow-up?
Yeah, I just want to keep this in perspective a bit. When you talk about 21% of the youngest children being vaccinated this year, we can't compare that to last year or the year before because of COVID and that. How does that 21% compare to, say, 2018, 2019, the more typical, historically typical flu seasons that we've had?
The short answer is we don't really know for a variety of reasons. And as you said, last year, influenza vaccination, we didn't record it in the same way that we're doing it this year. So with the Get Vaccinated system and recording of influenza immunizations into our provincial immunization registry, we have a much better idea of who's getting vaccinated and their age, their risk, etc. So it's very difficult to compare. We hadn't been recording influenza vaccinations in the same way prior to having this system that we have now in place. So we do know that from surveys that were done in 2018, 2019, that we would have, up to 30% of children vaccinated, but it varied depending on the year and depending on the severity of influenza. And that was always an estimate. So we have a better estimate this year. The one area it doesn't include is people who were vaccinated at their physician's offices, because we don't yet have a direct link to put those immunizations into our immunization registry, and we'll be working on that because it is really helpful for all of us to know what rates we have of vaccination, but also so that we can get our own vaccination records once they're into the immunization registry.
Our next question is for Ashley Joannou, Canadian Press. Please go ahead.
Hi, good afternoon. You mentioned going into the provincial registry to reach out to the families of kids who aren't getting vaccinated. Can you talk to me a little bit about what that's actually going to look like? Are people getting text messages? Are they actually getting phone calls from another human who can answer their questions about the vaccine? Like, what will that actually look like for these parents who aren't part of the system?
Yeah, thanks so much. Really great question. The Get Vaccinated system will use mostly the phone number. The information that we have in the registry for people who've never registered and get vaccinated is usually an address and a phone number. Very occasionally, you may have an email. If there's an email and or a phone number, we will send a text message, and if there is an email address, we'll send an email. So we're using all the information that the Get Vaccinated system can leverage to actually try and reach these parents. And as I said a bit earlier, we know that we won't get everybody, and that's part of the reason why we have a pretty significant communication campaign going on, a lot of social media from the government and from the health authorities, the Pharmacy Association, urging people to get vaccinated, telling them how to do that, as well as, a number of, we have posters. There's a lot of activity around the influenza season to let people know. But this is, a much more direct and targeted response to parents of the very smallest children, 6 months to 4 years, who, as Dr. Henry has said, are the most vulnerable, along with our seniors, for the impact of influenza. So text or email if we have that available.
Ashley, did you have a follow-up?
I do, yeah, thanks. So over the weekend, a code orange was declared at the Children's Hospital. I'm hoping that you can talk a bit about why that was called and how close we are to that happening again.
The code orange was called at 6:35 a.m. and canceled at 7:03 a.m. It was enacted based on the information at the time, but it was canceled when it was determined that the code did not need to be enacted in order to make a mandatory OT call-out, which is what was required. So people are managing, as you can imagine, have been managing the healthcare system on a routine basis. In that case, someone triggered the code orange with the best information. More information came in, and it was canceled, I think, 28 minutes later.
Our next question is for Moira Whiten, the Tyee. Please go ahead.
Hi, thank you for taking my question. Dr. Henry, you mentioned earlier that you want to use mandates as a last resort where they will have the most impact and benefit. can you talk to me about why masks in schools aren't on the table for you right now, given that children are being the most impacted, as you said?
Yeah, and masking is one of the measures that is needed in certain situations, and I talked about that a little bit in answer to Vaughn Palmer's question. It was one of the layers that was absolutely needed at a period of time where we had a lot of transmission of COVID, and in the context where we had a number of other measures in place, reduced capacity limits, increased ventilation, which is still an issue, making sure that we had the ability to work remotely or to have remote teaching if needed, etc. So there was a whole bunch of activity restrictions, travel restrictions that were in place when we had a mandate. Now we're in a very different situation. There are a number of different viruses that are out there circulating that are transmitted between children in many different settings, and having only a mask mandate and only in schools is very unlikely to have any difference and effect on the trajectory of the viruses that are circulating in our community. So a mandate is a rather heavy-handed measure that we do as a last resort when it's something that is absolutely needed everywhere all the time. And right now we're in a place where we have measures that can help mitigate the effects, and we can prevent transmission of some of these viruses through vaccination, and that's why that's so important. And there's other measures that we all need to take on an ongoing basis. We've talked about those, staying away from others when we're sick ourselves, wearing masks when it's appropriate or when we feel we need that extra piece of a bit of protection for ourselves, depending on the situation we're in. But it's not at a place where we would require that as a sole measure, as a mandate across the board. We do have mask mandates in the settings where it's most important that we have that additional layer of protection, and that's in our healthcare settings right now.
Moira, did you have a follow-up?
I do, and perhaps this is also for Dr. Ballum. Why are we not vaccinating kids in schools right now? We've seen in other provinces have really good uptake on COVID vaccines and other vaccine courses in schools, and it seems like there's quite a bit of urgency to blunt the wave, as you said. So why aren't we going into schools?
I'll start, and I can turn it over. As we talked about before, there's the highest risk age group for children are the children 6 months to 5 years of age who are eligible for vaccination, and of course they're not in schools. There is important vaccination programs that are run in schools, and in some parts of the province where it makes sense, schools are a place where people can get vaccinated for COVID and for influenza as well. But we know, and we've heard from parents, that most of them would prefer to have it done at their family doctor's office or in a public health clinic that's established for children, so they can bring all of their children, regardless of the age, and have immunization be provided to the family together.
We have time for one more question. Our final question today goes to Mira Baines, CBC. Please go ahead.
Hi, I would like the answers in English and French from my French colleagues. This one has already been answered in English, so I just need the French answer, hopefully from Minister Dix. The question is, why not bring in mandatory flu vaccines in schools, and also as part of that, why not vaccinate children in schools?
So we've talked about the vaccination clinics in schools. The other thing I would say is, with all of these viruses, we tend to spread them to the people that we have most contact with. They spread in families, they spread in our social connections, our social groups. And so schools in and of themselves are not the only setting where we're seeing transmission. And it is unclear if we would even affect the trajectory of what we're seeing in terms of spread, unless we had all of those other settings where we didn't have people in contact, where we had other measures in place. And that's what we've seen over the last 2 years, that when we don't have those social activities, we don't have those sports activities, we don't have people gathering and traveling, we can stop transmission of respiratory viruses. But we also know that that has a tremendous effect, particularly on children, on their emotional health, their physical health, their well-being. So, we have to balance risk and the measures that we have that can help prevent transmission, that don't interfere with all of those important social connections and activities that especially children need, but we all need in our communities. And so it is trying to find the right balance, as I've said for several years now, of looking at the whole picture, not just focusing on reducing transmission of a virus, but all of the things that we can do to protect ourselves when we're in groups together, but recognizing that those things that we do, whether it's getting together with family and friends, whether it's participating in sports events and tournaments and other things, those are also important for us in terms of our growth and well-being as a society.
C'est bien d'avoir cette réponse en anglais. Je dirais premièrement que je pense qu'il est absolument nécessaire actuellement, c'est que que des parents choisissent de faire immuniser leurs enfants. C'est plutôt 21% actuellement qui ont été vaccinés contre la grippe en Colombie-Britannique entre 6 mois et 5 ans. C'est à peu près la même chose, 20% entre 5 ans et 12 ans. Donc, c'est important et essentiel maintenant pour prendre cette opportunité de protéger vos enfants contre la grippe, bien entendu aussi contre le COVID-19. Pourquoi pas un programme de vaccination obligatoire? Maintenant, nous sommes premièrement à 21%. Donc, il y a beaucoup de progrès qu'on peut faire d'ici à Noël. Et je pense qu'il faut le faire. C'est important. Nous avons eu d'autres programmes de vaccination contre d'autres maladies depuis longtemps. Nous n'avons pas un système de vaccination obligatoire, sauf dans le système de santé, actuellement, contre le COVID-19. Mais c'est absolument important pour ceux qui travaillent dans le système de santé et pour les enfants qui sont plus vulnérables et pour des gens de troisième âge qui sont plus vulnérables de recevoir une vaccination contre la grippe. Et c'est pour cette raison-là qu'on a eu cette conférence de presse, mais aussi cette campagne et ces changements qui vont rendre plus facile la vaccination des enfants.
Mira, did you have a follow-up?
Yes, and this one in French and English too, if possible. There's a surge in young patients admitted to hospitals. What's the split or breakdown in respiratory illnesses between flu, RSV, and COVID around the province?
On a présenté des renseignements il y a quelques semaines sur cette question. Je pense que ce qu'on a vu avec RSV, c'est une relative stabilité vers la dernière année, bien entendu. Et on a vu cela un peu près. Dr. Henry vient de parler de cela. Mais il y a aussi, bien entendu, on continue d'avoir des gens dans nos hôpitaux de tout âge qui sont là ou qui ont testé positif pour le COVID-19. C'est à peu près 360 actuellement. Et puis, il y a ceux qui ont besoin et qui sont là pour la grippe. La plupart de nos préoccupations actuellement pour les enfants, pas pour tout le monde, mais pour les enfants, c'est la vaccination et l'effet de la grippe dans nos systèmes d'hôpitaux et dans nos salles d'urgence. On voit cela d'ailleurs un peu partout au pays et plus sévère dans d'autres régions que le nôtre. Mais je pense que cela représente et démontre pourquoi on parle de l'importance aujourd'hui de la vaccination pour les enfants.
and I think I got most of that, but maybe not all of it. But I just say there's a couple of things that we look at to help us understand what's causing infection across the province. And we do report that on the new respiratory dashboard on the BC CDC website, and you can look at it by health authority. One of the key things that we look at is the number, it's what we call lab-based surveillance. So when somebody gets a test, and we've done this for years, during respiratory season, if they get a test for a respiratory illness, whether it's in the emergency department, in a physician's office, that all goes to the lab, and we do what's called a multiplex test in the lab. So if there's somebody who's concerned about COVID, concerned about influenza, we have a test that allows us a PCR test that looks for influenza A, influenza B, RSV, and now we've added COVID to that. So that's what we call a multiplex test. So one of our key ways of understanding what's causing illness, respiratory illness around the province, is looking at that multiplex test and by age group and seeing what viruses come back positive. So that's on the dashboard, and we also have a system where we've been looking at the lab at Children's Hospital for many years, and you can go back to the old influenza flu bulletins and see the data there, and we've now added COVID to that. So if somebody gets a test when they're in hospital, in Children's Hospital or in the Emerge at Children's Hospital, and it goes to the lab, they automatically do those 5 tests for those 5 viruses. And that's what helps us understand what proportion of different viruses are circulating. And both of those lab-based surveillance, so it's not individuals, it's based on the first test that people have, and that lab-based surveillance is what tells us that we're seeing a lot of influenza, that we're seeing RSV had peaked and was leveling off, and that COVID was very young, very low in children. And we're also, it's broken down by age, we see that COVID is much more common in older people, either hospitalized or people being tested with a PCR test. So that's one of the main ways we can tell which viruses are circulating in which parts of the province, and that's based on lab testing. We also have other pieces of surveillance, and it's all a bit of a puzzle so that we can say, who's getting admitted to hospital, what age group, what are they being admitted with. We have what we call the Sentinel Physician or Sentinel Provider Surveillance Network, SPSN, that we've had for many years, and now we've added COVID to that, and that gives us a sense of how many people are visiting community providers with respiratory symptoms, and we can tell where it's happening in different parts of the province. So there are a bunch of different pieces that we put together to help us understand what's happening across the province and in different areas of the province. And all of those are on the respiratory dashboard on the BC CDC website.
That's all the questions we have for today. Thank you, everyone, for joining.
Thank you very much.